Hi, I'm Kristen, registered nurse with the UR Medicine Home Infusion Pharmacy, here today to teach you how to mix your medication with the Mini Bag Plus administration system and use gravity rate flow tubing to administer your medication. Before you get started, you want to make sure you have a clean work surface. You can just wipe down your surface with a disinfectant wipe or use spray cleaner and a paper towel or soap and water. Wherever you're working, whether that's your kitchen table or countertop, you just want to make sure you start with a clean work surface. Then you want to wash your hands with soap and water and dry with a paper towel, or you can use hand sanitizer to clean your hands. You just want to make sure if your medication is refrigerated that you take that out of the refrigerator about an hour before your dose is due so that it can warm up to room temperature. And you also want to check your medication label to make sure it has your name and your birthday and the medication you're expecting to be receiving on the label. All right, after your hands are clean, you're gonna make sure you have all of your supplies out and ready to go. So this system, the Mini Bag Plus system, keeps the medication liquid and the medication powder separate until you're ready to administer the dose. So you have to mix that before you're ready to do it. So you're just going to take this little light blue stem here and you're gonna break that back and forth until you break the seal between the liquid and the powder. Then you're gonna hold your fluid bag upright and you're gonna squeeze and let go. Squeeze and let go a bunch of times until you see that your vial is at least half full of liquid. And that liquid is gonna dissolve the powder that's in the vial, okay? So you just wanna give that a shake and help it dissolve. Now your medication may be a different color, that's okay. You're just gonna make sure that all of the powder is dissolved. You wanna make sure there's no clumps or chunks visible. And it's okay to give it a few minutes to make sure that it's completely dissolved. For video purposes, we're going to say that this is completely dissolved and the medication is ready to go from the vial back into the bag. So what you're gonna do is you're gonna tip your medication, the reconstituted medication, and then you're gonna squeeze and let go of the bag numerous times until you see all of the liquid go from the vial into the bag. We're just gonna do that over and over. Okay, now I can tell my vial's empty and that my bag is, all the liquid is in the bag. So you're just going to mix that by hand here. Make sure it's evenly mixed in there, okay? So now our medication is mixed and ready to get connected to our tubing. So you're gonna take your administration set tubing. There's a little arrow at the top to help you pull it apart so it can open. I'm just gonna take that out of the packaging, rip this paper off so that we can unravel our tubing. All right. So let's take a look at this. We have, at one end, we have a spike with a cap over it to keep it sterile. We have our drip chamber. If we travel down, we have our clamp, which is always nested inside the dial. So we're gonna slide that up so we can reach it better and pinch it closed. Our little dial, which is gonna set the rate for the infusion, is always set to open when you first open the package. We're just gonna twist that little arrow down to the word underneath, which is approx. That'll make it easier for us. And then we have our end that's gonna connect to our patient's IV line. So you're gonna take your medication bag and you're gonna remove this little blue cover. Okay. And then you're going to take your spike and take the cover off. Once we take the cover off, we don't want the spike to touch anything. You're just going to push and twist to get it into the medication bag. All right. Now that they're connected, we can hang our medication bag on the IV pull. Then you're going to squeeze and let go of the drip chamber until it's about half full. You want to leave some space in there so you can see the medication dripping. Then we're going to take our end and make sure we can see the end. You can open up the clamp and we're going to make sure that the medication tubing is full of medication before we hook it up to the patient. So before we're doing this, the medication is, or the tubing is full of air. We really want to always make sure it's full of medication before it connects to the patient. So we're just going to let this tubing fill with medication. Okay. It's going a little bit slowly here, but that's okay, so we can watch it. Once it gets to the end, we just want to close our clamp. And it's okay if you see a drop come out, but we want to make sure not too much comes out. We don't want to lose our medication out the tubing. So you're just going to close your clamp right when you see it get to the end. All right, so now our tubing is ready to be hooked up to the patient, but we're just going to get the IV line ready. So we're going to open up our sodium chloride or saline flush. Okay, and then we're going to get a new alcohol pad. Ready? Every time we connect to the IV line, we're always going to clean with a new alcohol pad. So right now there's an alcohol cap on the line, so we're just going to pull that off. And we're going to take our alcohol pad and we're going to wrap that around the end, and we're going to clean the end. We call it scrub the hub. And you're going to focus on the grooves and the flat part on top for 15 seconds. Okay, so we're going to clean and scrub for 15 seconds. All right, it's been 15 seconds. We're just going to take the cap off of our saline flush. After we take the cap off, we don't want to touch the tip of the syringe because that's sterile. We're just gonna, there's a little air bubble in there, so we're gonna pull down on the plunger to put a little more air in and then push the air out. So we're just gonna see a little drop come out the top. Then you're going to push in and twist to attach the flush. And we're gonna open up the clamp on our IV line. And then we're gonna flush with the push-pause method, or we call it pulsing. So you just wanna push, stop, until the syringe is empty. Okay. Then we're gonna twist our empty syringe off. That goes in your regular trash. We're gonna take another alcohol pad. And we're gonna clean the end. Same thing. We're gonna focus on the end, the grooves and the flat part on top, and we call it scrub the hub. And we're gonna do that for 15 seconds. So we're gonna say it's been 15 seconds. Then we're going to take our medication tubing. Once we clean that end, we wanna make sure it doesn't touch anything. If it does, you would clean it with a new alcohol pad. All right, so we're gonna take this little cap off of our medication tubing. That's keeping the end sterile. I'm just gonna take that off. Then you're going to push in and twist. Once we take that cap off, we don't want to touch the end because that's sterile. We're going to push in and twist to attach the medication tubing. And we're just going to make sure we set it to the right speed. Okay, so we had it set for the word approx because we were priming, but we want to make sure that it's set to the rate for the infusion, which in this case we'll say is 200. So we're going to turn our little arrow to the 200 on the dial. Your medication bag or your instruction sheet should have the rate that is for your medication. It may be a little bit different. It's either usually administered over 30 minutes or sometimes an hour. So the rate will depend on the length of time. So we're gonna say 200, and then we're gonna make sure that we open up our clamp on the patient and the medication. And then we'll be able to tell that the medication is going in when we see the drips right here in the drip chamber. So as long as you see those drops dripping in there, you know it's going into the patient. And we're gonna note the time that we get started so that we can monitor how long the infusion is taking. About halfway through, you just wanna make sure you see that the fluid is about half gone from the bag. If it's a little bit more or less, you can adjust the dial to slow it down or speed it up depending on how it's going. And then when it's empty, we're just gonna make sure that we close the clamp. So for video purposes, we're gonna pretend that it's been half an hour or hour, whichever is ordered for you. If you've been doing something else during that time, you wanna make sure you clean your hands again before you start taking care of the patient. If your medication tubing is going to be used more than once a day, the tubing is good for 24 hours. You want to make sure you have a red cap. Okay, this little red cap is going to keep the end of our medication tubing sterile in between doses. So we'll pretend it's done. So we're going to close our clamps on the patient and the medication tubing. We're going to open up our flush, so that's ready to go. We're gonna open up the packaging on our red cap so we can put that on the end. So you're just gonna hold that. I like to leave it in this little tray so it stays sterile. All right, so we're gonna disconnect our IV tubing and we're gonna make sure we don't touch the end. We're gonna grip the red cap on the wide part, and then that little narrow part is gonna go on the end of the medication tubing. And that's gonna keep the end sterile till we're ready to use it again. So you can just hang it on the IV pole with the red cap on and the empty medication bag. All right. Next, we're gonna make sure we flush the patient's IV line because right now it's full of medication. So we're gonna take an alcohol pad and we're going to clean the end for 15 seconds. Scrub that hub, scrub the hub. We're gonna do that for 15 seconds, so it's been 15 seconds. And then we're going to take the cap off of our flush, remove the air bubble and push up to get it out. Then we're gonna push in and twist to attach the sodium chloride or saline flush, open the clamp, and then we're gonna flush with that push pause or push stop. And you're just gonna do that until the syringe is empty. When you get towards the end, you just wanna clamp the line with that last little push of saline, okay? Then we're going to take our empty syringe off. If your doctor ordered heparin, you would clean again and attach the heparin flush. This often is not used, but I just wanted to show that. Then, now that we're done, we're just going to put a new alcohol cap on. So we always want to use a fresh one once we take the old one off. So this little cap protects the end of the IV line from collecting germs, and it has an alcohol pad which can kill germs. Using this will help decrease the risk of infection in the line. So we're just gonna push that on. You can give it a twist if you want. And then this outer cover is gonna come off. And as long as our clamp is closed and our alcohol cap is on, you're good to go until you're ready for your next dose of medication.